Hi, I'm Leonie Millard from Forbes Solicitors, and I'm here today with Anthony Burns to discuss Cauda Equina Syndrome. It's a rare but complex and serious condition, and we're going to look at how it's diagnosed and what the outcomes are. Anthony is from Ecovery. They are specialists in providing specialists. He is a senior physiotherapist and is expert in making such referrals. So Anthony, over to you. What is Cauda Equina Syndrome, please?
Yeah, Cauda Equina Syndrome is a rare and severe type of spinal stenosis where all of the nerves in the lower back suddenly become severely compressed in its briefest form. Okay,
and what symptoms might there be?
A myriad of different symptoms. So you could have pain radiating into your legs. You could have weakness or numbness in your legs. You could have numbness around your genitals or your saddle region. You could have, or equally could have, bladder or bowel dysfunction. And you can have, those are kind of like the classic symptoms that we're trained to look out for.
Given the difficulty and the various different symptoms, how do you actually diagnose it?
Yeah, so it wouldn't be me normally that diagnosed it. It wouldn't be someone like me, rather. It would be usually one of the medical team in your local hospital. But yeah, usually it would be, I believe, the gold standard is MRI to show if there is significant compression. I can show you an example of one if you like.
Yes, please.
So that would be yeah, that would be a kind of classic example of someone presenting with Cauda Equina. So you've got your these are your intervertebral bodies. These are kind of your lumbar intervertebral bodies, and these are the spinal processes. This is the spinal canal. The white area, I believe, is cerebrospinal fluid, and then you've got, I think this is L4-5. You've got quite significant compression there. So whether that's a herniated disc, or it certainly looks a little bit like a herniated disc, but I'm not aware of what this patient's presentation was. But yeah, that's a classic example of what they would find.
And so once you've seen that, what would you do from then? What are the next steps?
Well, yeah, like you say, I mean, I'm not, it wouldn't be me that would treat someone like this, but equally, usually the steps would be to preserve function. So the aim after that, if you've seen that diagnosis, or if your diagnosis is suspicious of Cauda Equina and you think that that's what's going on, then your aim thereafter is to preserve function. And usually that would be a spinal surgeon, whether that be an orthopedic spinal surgeon or a neurosurgeon taking that decision, and then they would make the decision as to whether to operate or not, and they would base that on a myriad of different factors. So the outcome for that patient may be spinal decompression.
And what are the consequences of a failure to diagnose, spot or treat Cauda Equina?
Yeah, I mean, they can be sort of catastrophic, really, for patients in terms of quality of life, really. I think that's how kind of you want to think about it, really, because you can have permanent loss of sexual function, possible paralysis of your bladder and bowel. You could have loss of sensation around your genital region and your saddle region, loss of power in your legs, chronic back pain, not to mention the myriad of mental health factors that can inevitably form as part of the outcome of that diagnosis, really.
Okay, well, thank you very much for speaking to us today. That's been really invaluable, and appreciate it. Thank you.
No problem.